Etiology: age above 65. Systemic diseases like HTN, DM, raised IOP. Drugs, for example oral contraceptives. Thrombophilic disorders. Inflammations, for example Ehlers disease. Types: 1. Non-ischemic CRVO. Most common type: sudden onset, unilateral, painless loss of vision, marked reduction in visual acuity, afferent pupillary defect is absent, IOP may be raised. Fundus: dilated, tortuous retinal veins. Blot and flame-shaped hemorrhages, cotton wool spots, mild optic disc and macular edema. 2. Ischemic CRVO. Sudden onset severe visual loss, marked afferent pupillary defect, raised IOP. Fundus: retinal veins are dilated and tortuous. Extensive blot hemorrhages, tomato-splashed appearance, severe disc edema. Investigations: all baselines, autoantibodies, fundus fluorescein angiography, FFA, optical coherence tomography, OCT. Treatment: antihypertensive drugs, treat the underlying cause. Thank you.